Glenn, May is National Stroke Awareness Month, and I'm joined by Dr. Megan Donohue with Intermountain Medical Center Neurosciences Institute to talk more about the signs and symptoms of stroke. And thousands and thousands of people die each year of a stroke. Explain what it is.
So there's two main types of stroke: ischemic strokes, where you don't get blood flow to a portion of your brain, and hemorrhagic strokes, where you actually have bleeding into the brain. But either way, it's a matter of blood cells, brain cells not getting enough blood.
So are the signs similar?
Yes, the signs can be exactly the same, actually.
Let's talk about the acronym BFAST in terms of reminding folks of what the symptoms are when we're in an onset of a stroke.
Yes, we like to use, like you said, the acronym BFAST. It stands for B-E, so balance and eyes. So if your balance is off or your vision is off. FAST, face, arm, speech, and time. So if your face is droopy on one side, if one arm is weak, if your speech is altered, either slurred speech or you're having problems getting words out or understanding, all of those are stroke symptoms, and you're supposed to look at the time. So remember what time it happened, and then get to the hospital as soon as possible.
Time is so important because the sooner you act, the better that you can save your brain cells.
Exactly. And the sooner you get to the hospital, you could be eligible for more treatments for stroke.
Let's talk about TIA, a mini stroke. Some folks may not be on high alert to call the hospital when they're suffering from a TIA. Explain what that is.
Right. A TIA is a transient ischemic attack. So we think it's the same mechanism as a stroke, but the symptoms may go away completely. And usually they resolve within a couple of hours. But there's actually no permanent damage, but it might be a warning sign for a stroke to come. So we think it's just as important to get evaluated.
Definitely don't ignore it.
Don't ignore it. Even call 911. Come right to the hospital.
And at this time of year, what do you want people to remember about strokes and saving your loved ones?
Right. Well, like you mentioned, May is Stroke Awareness Month. So the biggest thing is to get public awareness about stroke out there so that people know the signs and symptoms and they know what to do when they're having a stroke or they see a loved one having a stroke. The best thing to do is call 911 and get medical attention as fast as you can. And
what is the treatment after you suffer a stroke and you're in the hospital? What happens there?
Yeah, so we do have some treatments available, a strong clot-busting medication, and now we can even go in and take out a clot if it's causing a big enough blockage. So those treatments are only available within the first couple of hours, 3 to 6 hours after your stroke starts. So the sooner you get there, the more treatments you have available to you.
And more effective it is.
Exactly.
Let's talk about where people can find more information.
Sure. So you can find more information at your doctor's office or online. But yeah, the most important thing is to not worry about finding more information when you're having these symptoms,
Absolutely.
But just call 911 and let the medical professionals do all that work.
So look online right now what the symptoms are, and we have that information at goodforutah.com.